Welcome to the Phlebotomy Study Podcast. Phlebotomy is the clinical practice of drawing blood from patients for laboratory testing, transfusions, research, or donation. It is one of the most essential and frequently performed procedures in modern healthcare, a small act that carries enormous diagnostic power. At the heart of this practice is the phlebotomist, a trained healthcare professional whose skill, precision, and compassion make the difference between a routine blood draw and a life-changing diagnosis. Phlebotomists work in hospitals, clinics, diagnostic laboratories, blood banks, and community health centers, serving patients of all ages and backgrounds. They are often the first healthcare worker a patient encounters, making their role not only technical but deeply human. Beyond the needle and the vial, phlebotomists are guardians of accuracy. The quality of a blood sample directly affects the reliability of test results, and those results guide the decisions doctors make every day. From detecting diabetes and anemia to screening for cancer and infectious disease, the work of a phlebotomist quietly supports the entire diagnostic chain of medicine. This podcast is your dedicated study companion on the journey to understanding phlebotomy, its science, its standards, and its significance. Whether you're preparing for certification, refreshing your knowledge, or exploring the field for the first time, you're in the right place. Let's get started.
Phlebotomy Educational Dialogues. Real-world scenarios for California Community College students. Section 2. Infection Control. Dialogue 2A. Proper Hand Hygiene Protocol. Setting: Hospital Phlebotomy Department. Early morning. Characters: Dr. Patel, Infection Control Supervisor. Marcus, new phlebotomy student. Lisa, experienced phlebotomist. Scenario: Dr. Patel. Good morning, team. Marcus, I'd like to observe your hand hygiene technique before you start your first patient draw today. Marcus: Sure. Quickly squirts hand sanitizer and rubs hands for about 3 seconds. All done. Dr. Patel: Marcus, let me stop you there. Hand hygiene is our most important infection control practice. Lisa, can you demonstrate proper technique? Lisa: Of course. Dispensing alcohol-based hand sanitizer. First, I apply enough product to cover all surfaces of my hands. Watch, I'm using about a palmful. Marcus: Watching. That seems like a lot. Lisa: It needs to be enough to keep your hands wet for the entire process. Now I rub palm to palm. Demonstrating. Then right palm over left dorsum with interlaced fingers, and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of right thumb clasped in left palm, and vice versa. Finally, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Dr. Patel. And how long should this take? Marcus? Marcus. I'm not sure. Until it's dry? Lisa. Exactly right. At least 20 seconds, or until the alcohol has completely evaporated and your hands are dry. If your hands are dry after just a few seconds, you didn't use enough product. Dr. Patel. Now, Marcus, when should you perform hand hygiene in phlebotomy? Marcus. Before touching a patient? Dr. Patel. Yes, and when else? Lisa. Let me walk you through a typical blood draw. I perform hand hygiene before patient contact, before any clean or aseptic procedure, like preparing my supplies or palpating the vein. After the blood draw, I perform hand hygiene after body fluid exposure risk, after touching the patient, and after touching patient surroundings. Marcus. So basically, before and after each patient? Dr. Patel. At minimum, yes, but also between tasks if you touch contaminated surfaces or remove gloves. Speaking of which, do gloves replace hand hygiene? Marcus. Hesitantly. No? Lisa. Correct. Gloves don't replace hand hygiene. I still sanitize before putting on gloves and after removing them. Gloves can have microscopic holes, or I might contaminate my hands when removing them. Dr. Patel. Excellent point. Marcus, what about hand washing with soap and water versus alcohol-based sanitizer? Marcus. Isn't the sanitizer better because it kills more germs? Lisa. Not necessarily. Alcohol-based sanitizer is excellent for most situations and actually kills bacteria faster. However, I must wash with soap and water when my hands are visibly soiled, after restroom use, or when dealing with patients who have C. difficile or norovirus, because alcohol doesn't kill those spores effectively. Dr. Patel. Perfect explanation, Lisa. Marcus, remember, hand hygiene is the single most effective way to prevent healthcare-associated infections. Protects you, your patients, and everyone in the facility. Key learning points. Hand hygiene must last at least 20 seconds with alcohol-based sanitizer. Proper technique covers all surfaces of hands and fingers. Perform hand hygiene before and after patient contact. Gloves do not replace hand hygiene. Use soap and water for visible soiling and specific pathogens. Hand hygiene is the primary defense against infection transmission. Dialogue 2B. Managing a needle stick incident. Setting. Outpatient clinic, mid-morning. Characters: Angela, senior phlebotomist. Ryan, phlebotomy student. Supervisor Thompson. Scenario: Ryan: finishing blood draw, recapping needle. Ouch! Drops needle in sharps container. Angela: immediately alert. Ryan: what just happened? Ryan: looking at thumb. I think I just stuck myself with the needle while I was recapping it. It's just a tiny prick though. I'm sure it's fine. Angela: firmly but calmly. Stop what you're doing. We need to follow protocol immediately. First, go to the sink and wash the site with soap and running water for several minutes. Ryan: washing hands. Is this really necessary? The patient looked healthy. Angela: Ryan, this is absolutely necessary. You can't determine disease status by appearance. Many blood-borne pathogens are asymptomatic. Keep washing for at least 5 minutes. Don't use bleach or antiseptic, just soap and water. Supervisor Thompson. Entering. Angela: what's going on? Angela: Ryan had a needle stick injury. He's washing the site now. We need to complete an incident report and get him to employee health immediately. Supervisor Thompson. Ryan, after you finish washing, come with me. Angela, can you identify the source patient? Angela: yes, the blood draw was for Mr. Jackson in room 3. The tubes are labeled and haven't left the room. Ryan: drying hands. I feel so stupid. I was just trying to be careful and recap the needle before disposing of it. Supervisor Thompson. Ryan, this is exactly why we have a strict no recapping policy. Needle stick injuries most commonly occur during recapping. What should you have done? Ryan: I should have dropped the entire needle and holder directly into the sharps container without recapping. Angela: exactly. The safety mechanism on our needles activates automatically, but only if you don't try to recap. Let me show you. Demonstrating with an used needle, after the blood draw, I keep the needle pointed away from my body and anyone else, then immediately place it in the sharps container. One hand only. The needle never gets recapped. Supervisor Thompson. Now, let's discuss what happens next. We'll go to employee health where they'll document the injury, assess your vaccination status, and potentially start post-exposure prophylaxis depending on the source patient's status. Ryan: what will they test for? Angela: HIV, hepatitis B, and hepatitis C are the primary concerns. The employee health physician will also review your hepatitis B vaccination status. If you're not vaccinated or your antibody levels are low, they may give you hepatitis B immune globulin. Supervisor Thompson: Ryan, I know this is stressful, but you did the right thing by reporting it immediately. Many people panic and hide needle stick injuries, which is extremely dangerous. Immediate reporting and treatment significantly reduce infection risk. Ryan: How could I have prevented this? Angela: Several ways. Never recap needles, always use safety-engineered devices properly. Never rush during procedures. Keep sharps containers at arm's reach, and dispose of needles immediately after use. Also, dispose of needles yourself. Never hand a used needle to anyone else. Supervisor Thompson: Let's go to employee health now. Angela, please secure that blood sample and complete the chain of custody form. We'll need to test it as part of the source investigation. Key learning points. Never recap needles. Most needle stick injuries occur during recapping. Immediately wash needle stick injuries with soap and water for several minutes. Report all needle stick injuries immediately, no matter how minor. Source patient testing for blood-borne pathogens is part of protocol. Post-exposure prophylaxis is time-sensitive. Use safety-engineered devices correctly and dispose of sharps immediately. Prevention through proper technique is essential.
Medical Dictionary for Phlebotomy Students. Section 2. Medical Terminology. 2.1 Prefixes. 23. Anti. Against or opposing. Anticoagulants are additives that prevent blood from clotting in collection tubes. 24. Hypo. Below normal or deficient. Hypoglycemia refers to abnormally low blood glucose levels, which may cause dizziness and confusion. 25. Hyper. Above normal or excessive. Hyperglycemia indicates elevated blood glucose levels, commonly seen in diabetic patients. 26. Hema-/hema. Relating to blood. A hematoma occurs when blood leaks from a vessel into surrounding tissues, causing swelling and discoloration. 27. Leuko. Relating to white or white blood cells. Leukopenia is a condition characterized by an abnormally low white blood cell count. 28. Erythro. Relating to red or red blood cells. Erythrocythemia is a condition marked by an increased number of red blood cells. 29. Brady. Slow. Bradycardia refers to an abnormally slow heart rate, typically below 60 beats per minute. 30. Tachy. Fast. Tachycardia indicates a heart rate exceeding 100 beats per minute and may cause anxiety in patients. 2.2 Suffixes. 31. Anemia. Blood condition. Septicemia is a serious bloodstream infection that requires immediate medical attention. 32. Penia. Deficiency or decreased number. Thrombocytopenia is characterized by an abnormally low platelet count, increasing bleeding risk. 33. Itis. Inflammation. Phlebitis is inflammation of a vein, which can occur as a complication of venipuncture. 34. Lysis. Breakdown or destruction. Hemolysis is the rupturing of red blood cells, which can invalidate laboratory test results. 35. Ology. Study of. Hematology is the branch of medicine concerned with the study of blood and blood disorders. 36. Ossis. Abnormal condition or disease. Thrombosis is the formation of a blood clot inside a blood vessel, potentially blocking blood flow. 2.3 root words. 37. Phlebotomy. The practice of drawing blood from a vein for diagnostic or therapeutic purposes. Phlebotomy requires technical skill, knowledge of anatomy, and excellent patient communication abilities. 38. Venipuncture. The puncturing of a vein with a needle to withdraw blood or administer medication. Proper venipuncture technique minimizes patient discomfort and reduces the risk of complications. 39. Cardiac. Relating to the heart. Cardiac enzymes are measured in blood tests to diagnose heart attacks and other heart conditions. 40. Hepatic. Relating to the liver. The hepatic function panel includes tests that assess how well the liver is working. 41. Renal. Relating to the kidneys. Renal function tests measure waste products in the blood to evaluate kidney performance. 42. Pulmonary. Relating to the lungs. The pulmonary artery carries deoxygenated blood from the heart to the lungs.